Beauty means natural results, slow aging versus drastic change, skin that looks healthy without makeup, prevention over correction. And I would say that the best compliment patients want now is you look great, not what did you have done? You look refreshed, you look beautiful. What did you do without being directly obvious?
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk, where we feature the top medical practitioners in health and beauty, both inside and out. I have Angie Miller, a board-certified family nurse practitioner and the founder of Austin Aesthetic Couture, a luxury medical aesthetics and wellness practice serving the greater Austin area. With a clinical background spanning ICU, pediatrics, L&D, and the OR, she's known for combining high-level medical precision with artistic facial balancing for results that are refined, natural, and never overdone. Angie specializes in advanced injectable techniques, regenerative aesthetics, and long-term skin health plans. And she's also a respected educator who trains other nurses and providers in elevated safety-first aesthetics. Her mission is simple: help patients look like the most confident version of themselves while delivering an experience that feels truly couture. So Angie, welcome and glad to have you here.
Thank you, Daniel. I'm so glad to be a part of this.
Yeah, so let's start at the very top level. How did you first get interested in the medical field?
That's a great question. I've been in the beauty industry, not medical. I didn't start in medical. Actually started in the beauty industry back in 2012.
Hmm.
I'm still a licensed cosmetologist since then, so it's been over a decade of beauty, right?
Mhm.
And I come from a family that has a lot of chronic comorbidities. So diabetes, lupus, Sjogren's, metabolic diseases, even down to mental health. And so I thought as a young person, I was actually 19 when I went to college, I thought, how can I combine my passion for beauty and aesthetics with health? And as I got older, I thought, okay, let me find my niche, right? And so aesthetics like basically fell in my lap because aesthetics does combine beauty and health and wellness. And so I started in the beauty industry since 2012, and then I ventured into nursing, became a nurse with my bachelor's, and then I went to get my nurse practitioner degree, and I've been in aesthetics for 9 years now.
Wow. Okay. So you have this practice, Austin Aesthetic Couture. What led you to want to start your own practice? I mean, why not just work somewhere else?
I love that question, Daniel. I've worked for many med spas. I've worked for plastic surgeons in the OR, specifically facial plastic surgery. And during those years, in the last 9 years, I learned what I liked and what I didn't like so much about various practices. Um, and you grow as an individual, right? And so you take a little bit from every place that you work from, whether it's good or bad, and that molds you into the provider and the professional that you truly want to be.
Hmm.
And so after working for many med spas for many years, I got burnt out. I felt a little undervalued. I felt like some of the owners who were not medical professionals themselves, they didn't truly understand the passion that I had.
Hmm.
And so for me, I took my passion, I took what I learned from all of these jobs that I've had over the years, and I decided to branch off on my own and open up my own med spa. Because for me, I truly care about patient quality results. For me, it's not a number whatsoever. And that's what led me to opening up my own practice is quality and value in my clients.
Got it. Okay. So, Angie, now that you have your practice, I want to go into some of the treatments that your clients and your patients come to you for. I want to talk a little bit more about jawline slimming and lower face sculpting. It's a very kind of specific treatment that you provide. Can you talk a little bit more about that treatment, what you do, how you do it, and like in what situations would someone want to get that treatment done?
Sure. So jawline sculpting is wonderful. It can look very natural in aesthetics, and men and women both love it. It's for everyone. And we love jawline slimming included with facial balancing, so lower face balancing. You can use products like Juvederm Volux, Restylane Define. You can use Sculptra. You can use Radiesse. You can use different techniques such as Radiesse on bone, or what medical providers know as super periosteum placement.
Mhm.
You can use it with a cannula. So you can do like Juvederm Volux with a cannula, Restylane Define with a cannula on the jawline. And who this is for, it typically is for the people who they have a little bit of jawline laxity. So as we age, we lose 1% of collagen every year after 20 years old. So our superficial and deep fat pads, they come forward and they atrophy, so they shrink.
Mhm.
What that does is that creates early onset jowling here. And then we lose definition in the posterior region of what is called the gonial angle here. And so what we do is we go in, we restructure, we pull some of the tissue back by providing support with these pharmaceutical injectables. And then we go in and we use regenerative medicines like Radiesse and Sculptra to tighten and reform this dermal matrix, while also using fillers to give support and definition. So what that does is that helps pull back the tissue, create that nice, what people say, snatched jawline effect. And it really does help with some of this jowling that occurs as we age. Not everyone has jowling. So then we look at other modalities such as neuromodulators like Botox, Xeomin, Dysport, which are intramuscular agents, right? And this is going to be for those who have a more rounder appearance, right?
Mhm.
Not so much definition. Maybe they're on like GLP-1 drugs like tirzepatide, semaglutide, and they've lost several, pounds of fat, but their face still has hypertrophy of the muscle. So that's when we use Dysport, Botox, Xeomin. We go in and we inject it into the muscle down here in the lower face and the platysma, which is going to atrophy the muscle, so shrink it over time. And what that does is that creates a more defined lower face region.
Okay. So if I understand correctly, there's is two main scenarios in which this can help. People where they do have that jawline starting to sag just from older age. And so I guess you're pulling that back and tightening it so it looks slimmer. And then in the other scenario, they have kind of that rounder face. And basically what you're doing is kind of shrinking that area to make it look slimmer then.
Right, because for example, say someone comes in and they don't have the laxity of the skin tissue, or maybe they're not on a GLP-1, so they're not dealing with loose skin, right? So they don't necessarily need dermal filler. Maybe they're coming in and they have a more round appearance, and it's not always from fat cells or accumulation of fat cells. Sometimes it's hypertrophy of the muscle.
Mhm.
So how we know the difference is obviously our physical assessment and consultation, right? Talk to them about their health history, see what prescription medications are on. But then we also do the practical hands-on portion of the assessment. You have your client bite down, and oftentimes, if they do have hypertrophy of the muscle down here, like the masseter or the platysma, you can see that muscle pop out when they bite down. And
Mm.
so that's how we typically know they're a good candidate for lower face neuromodulator treatments.
Okay. Now, when it comes to these treatments, I guess, how many time, I know it depends on the person, but is something where you get it done once and you're good, or you need to do it like several times over a certain period of time? Like, what's kind of the most typical situation?
Sure. Um, well, for fillers, it's typically a one and done. Most fillers, I'll be honest. Some clients will come back in at about 3 to 4 weeks to do a follow-up, right? We always want to make sure that the filler is settling correctly because it does take about 3 to 4 weeks for filler to integrate into the person's natural tissue.
Mhm.
And if they feel like they need a touch up or a little bit more placement of that product, we'll go ahead and do so at that time. However, filler is typically like your one and done. But that's not for everybody, right?
Mhm.
So if you have skin laxity, then we're looking at things like Sculptra, hyperdilute Radiesse, maybe some skin tightening devices and lasers. Those are going to be done in a series of multiple sessions. So for Sculptra, you're looking at, one vial per decade of life. So if a client comes in, they're 50, we're looking at least 5 vials minimum. And so what that looks like is typically 2 vials over one session. They'll come back in 4 to 6 weeks. They'll do another two. They'll come back in again in another 4 to 6 weeks and do their last 2 vials. And so Everything is a little different. It varies depending on if it's dermal filler with hyaluronic acid or regenerative medicine, right? For regenerative medicine, it typically requires a few treatments done in a series. And then if you're thinking about jawline or lower face slimming with neuromodulators, that can be done over one session. And the best results are typically seen at about 2 weeks to a month in because it does take time for that muscle to actually atrophy, meaning to shrink. It's not done overnight, right?
Mhm.
But what I've seen in my 9 years of practice is clients love it so much. They'll come back at about 3 to 4 months after their first Botox or Dysport human treatment in the muscle for the lower face. They'll come back and they'll do one more session with me. And so typically I see those clients about 1 to 2 times per year, and they're very satisfied with the results.
Okay. And I'm sure you get this question a lot. Does it hurt?
Not necessarily, no. Um, for our clients, everyone's pain level varies. Genetically, redheads are known to have a lower pain threshold. Fun fact.
Mm.
But we can do topical, what you'll hear called BLT cream,
Mm.
benzocaine, tetracaine, lidocaine mixture.
Mhm.
I like to include phenylephrine, which is a pain reducing drug, in my topical agents. We can leave that on for a good 15 to 30 minutes. Dermal hyaluronic acid fillers do include 1% lidocaine in them, which is helpful. For things like Sculptra, we do reconstitute the drug with lidocaine itself. So we always include that pain reduction factor in every single treatment we offer. That's a really important part of every procedure.
Okay. Now, you did touch on regenerative aesthetics, and I want to bring this a little bit more to the forefront, as I think not a lot of people have heard of regenerative medicine, especially not regenerative aesthetics. So, could you explain from a high level what is regenerative aesthetics?
Sure. So regenerative aesthetics is definitely booming right now. It's definitely not a trend. Sculptra has been around and has been FDA approved for many years, and so has Radiesse. However, we're seeing that shift from instant gratification to long-term rejuvenation and long-term regenerative care. So clients are more educated now, and they want treatments that are going to improve skin quality, not just freeze wrinkles or fill lines, right? And then we have social media and overfilled faces that have pushed people to seek these more natural, undetectable results. Also, people want treatments that stimulate their own body, such as collagen types 1 and 2, elastin, and fibrinogen, which are the main components of the dermal matrix. Not just simple filler to quickly fill their skin and tissue, right? So clients are looking at long-term results, long-term rejuvenation. What that looks like is platelet-rich fibrin, such as PRFeZ gel. You might hear that coined a lot. PRP, such as platelet-rich plasma for microneedling or injectable. It's good for hair rejuvenation. And then you have your biostimulatory injectables, such as Radiesse and Sculptra, which are my two top sellers at our med spa. And then you have skin regeneration therapies like exosomes, peptides, PDRN, stuff like that. We're actually now going into even a higher level of regenerative therapies that include things like Wharton's jelly, which is amazing. I'm really excited to learn more about that and bring that into our practice. I don't want to say too much on that yet because we're not quite offering it just yet.
Mhm.
Um, but there are some new regenerative therapies that are including things like Wharton's jelly and amniotic fluid that are going to be game changing for sure.
Okay. So my overall understanding of regenerative medicine is that it is largely using your body's own cells, I'll call it, or material from your own body to basically regenerate yourself over time without having to use maybe anything like outside or like any kind of drugs or anything like that, and getting you a more natural look, and your body's basically healing itself. Is that, would you say, kind of a fair assessment of what it is?
Definitely. I mean, when we get down into the nitty gritty and the molecular science of these drugs, each one is very different from the next. And so it's hard to generalize them, right? But for the main top two that are very common in the industry right now, like Sculptra, That's made from polylactic acid, which is naturally produced by the human body, but it's a synthetic plant-based form, so PLLA. When that is injected into the body, it mounts an immune response. The body goes, hey, this is a foreign material. What is this? It sends in regenerative cells, growth factors, cytokines, and it starts to tell the body, hey, we need to regenerate this area of tissue where this drug has been injected.
Mm.
In response, over the next 4 to 6 months, Sculptra starts to stimulate collagen types 1 and 3, elastin cells, and fibrinogen. And so it's restructuring that dermal matrix and it's forcing it to regenerate itself.
Mm.
And
Okay.
so that's how Sculptra works. On the other hand, you have things like Radiesse, which works similarly, but Radiesse is very different from Sculptra in the sense that it is also a biostimulator, but it is a filler as well.
Mm.
Okay. And that's where a lot of clients get confused. They're like, which one do I do?
Mm.
And so Sculptra is not a filler.
Mm. Okay.
Mhm.
So then with regenerative medicine, because I think, again, this is something that not a lot of people have heard about, particularly in the aesthetic side. So is it safe? Since it's newer, is it safe?
These therapies have been around for over a decade. Sculptra was first used for lipoatrophy in HIV positive patients. So it's definitely very safe. And it's plant-based, it's strictly regulated, it is a prescription drug, it has to be ordered through a doctor, a nurse practitioner.
Mm.
However, if a client or someone has an immune issue, right, or autoimmune disease, for example, like diabetes, where they don't necessarily heal as well as the average person, this might not be a good option for them unless it's strictly controlled, right?
Mhm.
People with autoimmune disorders, they don't react well to foreign objects in their body, right? And
Mm.
we don't want to elicit some kind of exacerbation of their disorder. And
Mm.
so Radius and Sculptra bioregenerative therapies are typically safe for the average person unless they have an active or ongoing autoimmune or skin disease, active cancer, and stuff like that. Those kind of clients would not be good candidates. However, for the majority of the population not dealing with those, comorbidities, it's definitely going to be safe.
Got it. Okay. Now, for these treatments that we were talking about, the regenerative aesthetic side, the jawline slimming, what would you say is some of the most common misconceptions or myths that you hear from your clients, particularly when it comes to these treatments? So I'm sure there's a lot of things they believe is true, but it's just not. So what are some of those common myths or misconceptions they have?
A lot of clients who are new to aesthetics and they hear about these regenerative therapies, they go and do their research on Dr. Google's what I call it. And, not everyone's going to have a good experience when you go online. And so it's really easy to run across false information such as, oh, Sculptra is necessarily just injecting concrete in your face. Radiesse is just, doing the same. You're injecting concrete in your face. It's going to cause scar tissue. It's going to damage your, layers of tissue in your face. I've heard things such as like, oh, now all of your 9 layers of tissue in your midface are going to come together and not be able to be separated down the line. For example, if clients are looking forward to maybe a deep plane facelift, right, in their later years, um, you know, they're worried that Sculptra or Radiesse might cause them to not be a good candidate down the line. However, we do know now that that is false. I've worked alongside some facial plastic surgeons, some really the best, like double board certified plastic surgeons out of LA, New York, Chicago. I've done some cadaver courses with them where we actually dissect the human face on populations who have received these regenerative therapies. And we have identified that, there is no cause and effect for these myths that are coming about.
Mm.
I think a lot of people, maybe they're going to underqualified providers or non-providers, which is crazy that people are allowed to inject and not be a provider. And these medicines, they have to go into a certain plane of tissue, right? And so if you're going to the wrong person, it's not being injected correctly, it's not being reconstituted correctly, that's when things can go wrong,
Mm.
you know? Yeah.
So with that in mind, then let's say someone is looking for some type of aesthetic treatment and they don't know which provider to go to. What advice would you give to that person to help them in their search so that they find that provider which is experienced, knowledgeable, and can get them the results they're looking for?
I would say everyone's on social media now. Get out there, get on Instagram, get on Facebook, go to their website, see if they have any blogs, see if they're posting before and afters on their socials. I think that's the number one thing is before and afters. You know,
Mm.
go and see what your provider can actually show you physically with
Mhm.
results. Results speak volumes.
Mhm.
Blogs speak volumes. Being an educator speaks volumes. And so I would say also schedule a consult, you know. First, go see if you like their before and afters, make sure they're professional, make sure they're licensed. It's very easy to look up and see if someone is licensed in your state. And then just go and schedule a consult. See if you vibe well with that provider, see if they know what they're actually talking about during the consultation, and if you feel safe. And you don't always necessarily have to book the procedure right after, right? Most clients do, though. I will say for my business, most clients are game. They're ready to get it done, they feel confident and happy, and they leave happy.
Mhm.
Um, but it's always good to meet the actual person, walk in their room, make sure everything is clean, sterile, make sure they're compliant and they have their licenses up on the wall, right?
Mhm.
Make sure also too, ask them, interview the provider, hey, if this happens, do you have an emergency protocol for this? You know, if I experience this kind of side effect, what is your protocol for that? How would this be handled? Do you schedule follow-ups? These are all very necessary questions to ask a provider prior to any aesthetic treatment.
Got it. Good to know. Now, Angie, I know with your background in beauty, you have a kind of a different perspective than people that just come in through the medical side. So I'm curious, what role do you believe creativity plays in how you approach your patient care? So I think that creativity is not necessarily a word that most people would associate with medical treatments.
I know.
But what do you like? What role do you believe creativity plays?
Creativity is everything. Creativity, it comes down to, you know, how your behavior is as well, how you carry yourself. Are you a creative person? Are you open-minded? Are you good at listening with creativity? Are you good at, you know, a hands-on approach with creativity? Do you have the extra clinical thinking skills for your client, right? Because a lot of clients will come in and they want just one thing. But are you creative enough to look at the entire picture and say, okay, I know that their focus is on this one thing, maybe it's Botox, but it's our job as a provider to be creative enough and clinical and skilled enough to see the bigger picture and know what's best for the client. And that's where expertise really comes down, you know, and that's where your clients are going to value your creativity versus just being a medical professional because you can inject dermal filler all day, you can inject Botox, you can start IVs all day. But if you don't truly have that creative nature in you and you don't really know what clients are going for aesthetically, it's going to be really hard to scale a business just based off of a medical knowledge approach, right?
Mhm.
And so we are sculpting clients with dermal filler. We are regenerating their tissue, but there's a look that people are going for, right? We have to balance that medical outcome with the aesthetic physical portion as well. And that's where creativity has to come in. And typically, as an educator, when I do, you know, my interviews for RNs, NPs, or MDs, I always ask them, have you ever had experience or a background in art? Right? Maybe in high school or college, because I definitely did, especially being a cosmetologist. And that's one green flag when they say yes, or, you know, they have that artsy side to them. I'm like, okay, you know, this is a good sign. And so that's a great question.
Interesting. Okay. Now, Angie, I'm sure that throughout your experience, you've had some memorable cases or challenging cases that you've worked on. Is maybe one story you can share of one of those cases that comes to mind and how you were able to get them a great outcome in the end?
Sure. So I have this one client who I love so much. She went somewhere And unfortunately, the doctor was not board certified, but
Mm,
claimed to be board certified.
mm,
Claimed to have a huge background in aesthetics with over 2 decades of experience, which she didn't, unfortunately. And she did threads on my client. So threads are surgical sutures, essentially, and they dissolve over time in the layer of tissue that they're placed. My client trusted this person, didn't really do much of an interview, didn't ask for qualifications or compliance, any certification, just trusted this person.
mm.
And the threads botched her face terribly to the point where she had facial nerve damage. She had weakness on the right side of her face, mid to lower face. She couldn't lift or smile for about 7 months.
Oh, wow.
It was bad. She was completely numb here. And to worsen the overall case, the provider left her with a thread hanging out of her hairline. And it caused infection around the opening of the thread because that skin could not close over time due to that undissolvable suture that was hanging out of the hairline. And so that caused her to have an abscess and an infection. And I was able to meet this client. This is our initial encounter. She explained all this to me, and I felt terrible for her.
Mm,
I educated her thoroughly, and we created a game plan for her, or a care plan, a long-term care plan. And I sent her to a facial reconstructive plastic surgeon in LA who was able to assist her in removing the superficial threads properly.
mm,
She was started on certain medications for the nerve damage, which slowly but surely resolved over time. We did a series of PRF Easy Gel Sculptra to regenerate the tissue that had been damaged by the threads. Since then, we've done probably 3 rounds of hyperdilute radius to help with the skin laxity that was caused by the threads. It left quite a bit of puckering in her mid to lower face. We've done some hyaluronic acid dermal filler in the jawline to restore some of the elasticity that was lost due to the threads. And we've created a full-term care plan, and now she's one of my top clients.
wow. That's one heck of a story, but it sounds like it was a great, it was really good that she found you.
She was so happy. She texts me all the time. She actually texted me this morning, and she's always looking forward to her next treatment.
That's awesome. That's
Yeah,
awesome.
and I tell her, I'm like, you don't need anything else. We've got you exactly where you want to be. But she just loves now getting her treatments done so much. She's always looking to get, something done, even if she doesn't necessarily need it just yet. But just, building that trust with clients and being able to get them to a better place in their aesthetics and overall, wellness is definitely important.
Yeah. Okay. So Angie, where do you think the future of aesthetics is going?
Hmm, great question. As far as surgery or injectables, what do you think?
Either one. Yeah, just the overall future of the industry.
I think we're moving away from being overdone, exaggerate, overdone, overfilling, one and done appointments, where we don't necessarily create care plans. I'm definitely moving away from that.
Mm,
I want to create a trusting relationship with every single client that I lay eyes on. I want them to fully trust me as their provider and know that we're in this for the long term.
mm,
And so I know a lot of clients have had bad experiences. And so I allow them to relate that to me during their initial consult. And then I create that long-term care plan with very transparent pricing and realistic expectations about what I can do for them and where I can possibly get them to.
mm.
So we're moving away from that instant one and done, overfilled, to long-term care, regeneration, long-term regenerative aesthetics.
Okay. And with that in mind, what is your vision for your practice, Austin Aesthetic Couture?
My vision for my practice is to create a luxury environment, which we've done already.
Mm,
We don't want the low ballers. We don't want clients who are coming, hopping around, sale to sale. Those are our red flags. We don't create, and we haven't created a clientele like that actually. We do know that these are investments that our clients are making. So we do offer promotions. We have a loyalty program, and we do offer new client specials for our new clients that come in. And so we understand it's an investment. We do know that. But our long-term goal is to create luxury, to create that education and that safe space where clients come in and they are immediately at ease and they know that they're going to leave happy and that this is their safe place for their injectable treatments, or maybe even for their weight loss, peptides, hair regeneration, IV therapy. I just want it to be a place for women and men to come in, and it's a trusting and luxurious environment where they know they're always going to leave happy.
It's a wonderful vision you have for the practice. So, Angie, I have one last question for you, but before I ask it, I do want to point people to your website at austinestheticcouture.com. Now, last question for you, Angie. What does beauty mean to you?
Beauty means natural results, slow aging versus drastic change, skin that looks healthy without makeup, prevention over correction. And I would say that the best compliment patients want now is, you look great, not what did you have done? You look refreshed, you look beautiful. What did you do, without being directly obvious? Beauty also stems from internal realization of oneself, right? Because you can look beautiful on the outside, but if you're internally not feeling beautiful, there's a mismatch there. And so for me, beauty is internal wellness, mixed with external beauty and wellness as well. They both have to coexist.
Awesome. Well, there you have it. Angie sharing her expertise. So, Angie, where can people contact you in your practice?
They can contact us at 830-310-2401. That number is on our business. They can also contact us directly on our website at austinestheticcouture.com. We do have a chat button. We do have an email that they can contact, which is on the website as well. There's multiple ways to get a hold of us. We also have a Facebook and Instagram platform, and we respond within 5 to 10 minutes of any new leads coming in. So there's multiple ways to get a hold of us.
Awesome. Well, Angie, this is awesome. Thank you for coming on. Thank you for sharing your expertise, and thank you for sharing your message.
Thank you, Daniel. Thank you so much. It's been a good time.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.